Hello, and welcome to another episode of The Case For. I'm your host, Matt Campobasso. So, what if the most effective healthcare provider in America is not a hospital? What if the answer to our national burnout crisis isn't found in a doctor's office, a government mandate, or a wellness industrial complex that's currently trying to sell you magnesium gummies and a $400 red light face mask? As an attorney managing the legal function for billion-dollar companies, I spend my life looking at incentives. And here's the hard truth. Most stakeholders in our current system actually profit from your illness. Big pharma, the treatment-based insurance model, even the apps on your phone. They often thrive when you are in a cycle of management and not actual wellness. But there is one major player whose bottom line is directly tied to your genuine, sustained well-being. There is one entity that loses money every time you're stressed, distracted, or sick. Today, my guest, Kara Lenz, is putting a radical idea on the stand. It's a shift from well-being as a perk to well-being as infrastructure. And after this, Kara will enter the courtroom to make the case for employers as the answer to America's health crisis. Welcome back. Today, we're going to make a case that sounds big. It sounds ambitious, but it's exactly the kind of architecture that deserves a real hearing. My guest is Kara Lenz. Kara is a leadership transformation coach and consultant who has spent nearly a decade running her own firm. Before that, she was in the engine room of one of the world's most successful companies, serving as talent and development manager at Apple. She is also the author of the 2025 book, Health Wanted, Inquire Within, a 5-step guide to lead yourself and your team from burnout to brilliance. Kara, I've been looking forward to this session. Your work, as I see it, sits at the intersection of neuroscience, psychology, and the brutal reality of modern work. As a 47-year-old father of 3, I absolutely see burnout in my own circles. I see it in the mirror some days. People are tired, leaders are overloaded, and well-being has become vaguely performative. But before we jump into the specifics of the case you're here to make today, why this? Tell us a little bit about yourself, who you are, what you do, and why are you staking your reputation on the idea that employers are the ones that have to save us?
Thank you. Um, a little bit about me. I grew up in Iowa. I live in Minneapolis now, so I am a very kind of practical Midwest, get work done. I come from that background. And so the practicality of work has always been something that's been super important to me. And then when I was in my graduate work at Iowa State, I really started, this isn't, it really comes from a place of not wanting to go to work. I was in college for a long time because I loved school and having this mentality of, oh, work kind of sucks. And so thinking, if people have to go to work, how can I be in a position to help people make work a little bit better if we all have to do this? So I really started studying that work-life balance. What does that look like? And then have spent, 20 plus years in human resources, really focused on leadership development. And then through some kind of unconventional journey, I think really ended up kind of that at that intersection between leadership, well-being, and organizational performance. And I have a huge passion around how people feel in life. And I think leaders can change the world.
Before we jump into your opening statement, tell us a little bit about your book. You don't need to go into the theories in the book and those sorts of things. We'll talk about that in a moment. But tell us what prompted you to write this book and why that's a topic you're so passionate about.
I wrote this book because I needed this book about 8 years ago, 8 or 10 maybe years ago. I wish I would have had it. And I was struggling personally. I was very impatient, annoyed a lot of the time, not liking who I was, finding myself having to apologize for just kind of popping off sometimes at people and not having a lot of patience at work. And I didn't know how to manage the stress from the work very well. And so once I started looking into it, the impetus was really this neuroscience class I took for coaches. I've been a leadership coach for a long time. And it just really started to realize that there are things that we can learn that can help us deal with life and with stress, whether that comes from work or whether that comes from personal issues. And once I started to learn that, I couldn't keep it inside. All my friends heard me talking about it, and I felt like I needed to share it. And it kind of hit me one day the organization and how it all worked, and I just started writing, and out it kind of seemed to just flow through me.
Very cool. I actually just read the book by Stephen King. It's called On Writing, and it's a bit of a
Mm.
memoir of his, and it's about how he discovered his love for writing. And there's a line somewhere in the book where he says something along those lines, which is,
Hmm.
you have to write a book when you can't stop thinking about something or talking about it, and you just have to get it out. So you
Yeah.
and Stephen King have that in common.
That's awesome.
So Kara, this is the part of the show where you get to give an opening statement. And obviously, you just laid out a bit of foundation about your background and why you're passionate about these topics. But for the next few minutes, I would love for you to lay out for our listeners, the jury here, um, what is the case that you're trying to make? And we'll get into the evidence in a bit and some
Okay.
objections. But what would you like the listeners of this episode to believe when this hour wraps up?
As you said in the intro, I'm making the case for employers as the answer to America's health crisis. And I've also had or always had a personal passion around well-being in general and health, and realizing that America's health is in crisis, whether people want to admit it or not. And the United States spends nearly twice what other high-income countries spend on healthcare, but we have worse outcomes across the board. When you look at life expectancy, infant and maternal deaths, suicide, assault, health or heart disease, diabetes, all of it, obesity, we're worse than almost every other nation out there, high income nation. And mental health is just as bad. And people are really struggling. And I had this realization that there are entities out there, there are people, doctors, psychologists, alternative health care professionals who are really trying to make a dent in this one-on-one, but we're getting sick at a much faster rate than people are getting well. And so there's got to be a bigger push. There's got to be something bigger that helps the health of America. And I truly believe that employers are they are our most powerful lever to really combat this. And for a few different reasons. Number one, they have a massive financial benefit when people are well. They're the only big stakeholder in this country that benefits when people are well, and they pay the costs when people are sick. And that alone should be enough to get employers to pay attention to this. But another reason they're really positioned to do this is because well-being, science is showing us that well-being is a skill that anyone can learn. It's not a personality trait. And the best group at teaching skills are employers. We already do this. Employers do this every single day. They teach job skills, time management, project management. They are excellent at teaching skills and then creating a place for people to practice them and to put those skills into place. And so if we can start treating well-being as not a personal problem, but as an actual capability within an organization that leads to the bottom line, it can make a huge difference in America's health and benefit these companies. And then I'll make one more
Please.
point, if that's
Yeah.
okay. I'm very passionate about this.
No,
And then
please.
the third thing I would say is they have access to employees almost every single day. Where a doctor sees you every now and then, your employer sees you almost every single day, whether that's online or whether it's in an actual workplace. And so employers inherently impact how we sleep, how we manage stress, how we eat, how we show up, just by the very nature of they are a consistent presence in our lives. And so for all three of those reasons, they are in the perfect position, and they have a financial incentive to really make a difference here in our well-being.
So, first of all, well said. As I mentioned before we started recording, I recently ordered your book. I haven't had a chance to read it. I've read a lot about it and the things you're talking about today online. I don't know if I've ever seen a trial won in the opening statement. I've definitely seen them lost. But if it's going to happen, I feel like you maybe just did it. I
Mm.
think, as a lawyer myself, I tend to listen to people when they're kind of laying out what they want to advocate for, and I look for holes. And we'll talk about some objections here in a bit, but I'm not seeing any. I think a couple things, and then we'll move into the evidence. Number one, I recently did an episode based on a book called Upstream, and it was written by
Okay.
Dan Heath. And the whole concept of upstream is looking at damage or risk or friction and working backwards to figure out how can we get ahead of this. And to your point, companies are perfectly situated to have that sort of influence on their employees, not only to just be good corporate citizens, but to your point,
Yes.
and I think that's probably why you led with point one, it's the bottom line. They stand to benefit. I would imagine, and you could tell me as we get into the exhibits if I'm wrong, it's hard to quantify that though. It's not a 1 + 1 is 2. It's a 1 + 1 is, ellipses 2 at some point. And so it's hard to see that intrinsic or empirical evidence that that investment by companies is having that return that you talk about.
Yeah.
And the third point that you made, which is about access, as you were talking about that, I was thinking about, I mentioned I have 3 kids. I don't expect my children's school to teach them everything about the world, but their teachers and the administration have access to them more time each
Mhm.
week than I do during a normal school week. And so I think about social skills and math and, reading and English, those sorts of things. Schools are best situated because of that intensive captive audience they have with our children. I think that
Yes.
logic moves over to companies and employees exactly the same way.
Yep. It absolutely does. Yeah.
So, Kara, you've laid out your case. You've touched
Yeah.
on a little bit of this, but I want to take a minute to go through some exhibits here and you can expand on some of these concepts. So, here we're going to move beyond theory or things that you believe or you want the jury or the listeners to believe into some proof. And so, I'm going to ask you some questions. The first one is going to be around Exhibit A, which is around incentives. You spoke about that a bit.
Hmm.
But in a trial, when I try a case, which it's been a little bit, but you follow the money if you're looking at bad actors and motives. Most of our healthcare system wins when we stay in the treatment cycle, as I mentioned at the beginning of this episode.
Yeah.
Doctors get paid when we visit, pharmaceutical companies get paid when we refill prescriptions. But tell us a bit about what your book talks about and what you believe around who actually does win when an employee is genuinely and sustainably healthy.
Yeah. It is a really great question. It is the question, in my opinion. And the simple answer is employers win. When employees are healthy, the employer benefits, period. And we know this intrinsically, right? We know if you're if you're thinking of yourself back on the playground and you're picking out your kickball team, you pick people who have athletic ability, who run quickly, who are able to kick the ball. And employers know, leaders know intrinsically somebody who can manage their emotions, who can take feedback, who don't procrastinate. Those are better employees. We know this intrinsically. I do lay out the business case very clearly in my book. Um, but the employers win in several fronts: lower turnover, higher productivity, lower healthcare costs, all of the better decision making, even. And it is very difficult to quantify, as you said, and there are a few different ways that people quantify this. I wish could be a number on the P&L that said
Mhm.
exactly what mental health and mental distress is costing employers, because I know they would pay attention then.
Yeah.
But the World Health Organization, now this is globally, of course, but they estimate that approximately 12 billion working days are lost to depression and anxiety alone, which is over $1 trillion in productivity every single year. And if we narrow that down and even think in the United States, there's an organization called the National Safety Council, and they've actually created a calculator that employers can go to, put in the state where they work, and it will calculate out anyone who is any employee in your organization who's experiencing mental distress, what that costs you. And on average, it's about $15,000 a year. And according to surveys, now surveys can vary, so the numbers are anywhere between 46 and about 80% of employees, of American workers at any point, are experiencing mental distress. So take your number of employees times between 46 and 80% times $15,000 per year, and it is a very expensive problem. And not only are they more costly, but healthy employees are higher productivity, higher customer satisfaction. They create higher customer loyalty. The numbers are all there.
That study and the quantitative data there really drives home your point. And I think that's, if I think about my role as a manager and as an executive, when we talk about things at our company around priorities and things like that, you're always looking for the shortest thread between doing something and either saving money or doing something and making more money, because these are for-profit
Right.
businesses and they're trying to increase the health of the bottom line. And it's incredible because it sounds like we've come a long way in quantifying that, and there is definitely data, but it just seems like these concepts, while logical and reasonable, and I hear you and I think, okay, yeah, that's a no-brainer. What has your experience been in your research and in writing the book that is kind of the brick wall that companies can't seem to get past?
Yeah, the brick wall is often Wall Street. And so at the end of every quarter, when people have to uh, report earnings out to Wall Street, and they have a fiduciary responsibility to their shareholders, when things need to be cut. I've been in those rooms with leaders as they're having conversations around, we've got to report to Wall Street,
Mhm.
and things have to be cut. And unfortunately, well-being programs or thinking about what is important to employees is one of those things that they feel like can be cut quite often because they're not thinking long term when we have these quarterly responsibilities to the shareholders, which is still important. So,
Oh, of course, it's balance, right? And I
yeah.
think my last company was publicly traded, and I was also in those rooms when conversations were happening around, what are we going to report out? How will the market react? And to your point, you are a public company for companies that are public,
Yeah.
and you have an obligation to shareholders to be profitable and show growth. And I was going to ask the question, but you hit the nail on the head before I had the chance. It's that tail, right? They don't have the luxury because quarters come quickly. It's every 14 weeks.
Mm-hmm.
And so, or 12 to 14 weeks. And you don't have the ability to say, hey, let's invest this money now. And in 3 years, we're going to see this big pot of gold. It's okay. Something's got to go. This doesn't directly tie something that I've seen empirical evidence is good for us financially. And if it is good for us, which it might be, I don't have as much time to wait, because if I don't make numbers this quarter, I'll lose my job.
Yes.
And so it has this like negative flywheel effect, it sounds like.
It does. And it's one of the things I work hard to remind employers of is they are not only does this cost impact them, but they are working against, and you didn't allude to it, you said it outright, which I love because it is controversial, but there are systems in our world that benefit when we are unhealthy. They to to appease their own shareholders, if we think of big food or social media platforms or the pharmaceutical industry, this overconsumption and this chronic dependence on their product or their offering is what creates unhealthy people. And so they rely on people being unhealthy and being dependent on their product or dependent on their service or this overconsumption. And I don't think it's necessarily, I don't want to believe necessarily it's about bad people. It is
Mhm.
just, it's the way the system is set up. And so employers have these big forces that are working against them that want to keep people chronically unhealthy, and then employers pay the price for it on the other end.
Not to be too on the nose, but if you take something that, while delicious, can be unhealthy, like potato chips, you think about Frito-Lay, the executives of Frito-Lay aren't thinking about the collective well-being of the world or our society. They're thinking,
No.
hey, I'm being paid to help this company grow and be profitable. And so that's somebody else's problem. It's not in my backyard, so it doesn't affect me. The problem is here, based on some of the numbers you've shared, this is affecting all of us. And it's also not
Hmm.
just affecting us as humans who are navigating this health crisis, but it's our companies and it's their ability to continue to pay us and employ us. And what I hear is something that's just not sustainable. And I think anybody who has eyes and ears and pays attention to the news, you mentioned those examples, whether it's, food, pharmaceuticals, social media, there is that level of what's your business strategy? Well, it's indulgence or gorging, right? It's engagement. And so, but at what cost? There are people
Yeah.
asking those questions. That's part of why you're here today. But unfortunately, as we've all seen, and especially in a democracy, the majority has to care about something. And I think
Yes.
everybody's too busy pointing at each other and hoping somebody else will figure this out.
Yeah. And it's compounded a little bit because those industries are super necessary. I mean,
Mhm.
pharmaceuticals save lives every day. Big food feeds America. Social media, it keeps us connected. So they're
Mhm.
they're really important industries that just the need to appease their shareholders is drives this overconsumption and this need that keeps us unhealthy.
Exhibit A, let's put that in the record. We'll move on to Exhibit B here, which I'll refer to as the water that we swim in. So the second piece of evidence that I'd love to hear from you about is access. So a few minutes ago, you mentioned, employers are uniquely positioned because they own the environment. I mentioned schools and my kids.
Yeah.
In legal terms, the premises or where does the liability fall or opportunity? Tell us a little bit more about that. Make those ideas concrete.
Okay, I will start by answering that question with kind of a question myself, is saying, how many times have you heard an employer say, or has someone said to you, is don't let your personal life impact your work? And I am
Yes.
guilty. As an HR person, I said that a lot in my career. But I've never heard any leader turn that around and ask an employee, hey, is work stress impacting your personal life? And if so, how is it? And I think about one way that you or your listeners can even kind of make this more real is maybe close their eyes if they're not driving and just think about driving home from a day of work that's super stressful. If you have a stressful job, you were very productive. But in this stressful day, people were snapping at you. There were a lot of demands on you, on your time. You didn't have time to take a quick break, let alone a lunch, like you're shoving your turkey sandwich in your mouth for lunch. Treated disrespectfully by your boss. And then think about, what's your drive home look like, or what does the end of the day look like on a day like that? And how you talk to your spouse and how you talk to your kids. And what are your activities? What do you decide to eat for dinner that night if you're just kind of in this big hurry and exhausted? Are you binging Netflix? Are you scrolling on your social media platforms? And then if we change that and say, like, okay, kind of shake that off and think about the same stressful day where you're very productive and you had a lot to do and it was still very stressful, but your boss was supporting you, your coworkers were supporting you. You had a quick, 10 minutes even to grab lunch, to just breathe and to reset for the afternoon. Um, what does your day look like then at the end of the day? How do you treat the people on your drive home? How do you treat the people in the grocery store line? How do you treat your family when you get home? It's a very different experience. And work changes people's emotional states. It just does. It's the nature of work. And so there's one study that asked people, and 71% of people reported that work stress caused a breakup, or whether it's ended a relationship, whether it was causing a breakup or a divorce, that work stress significantly contributed to that. And it's something that just impacts our lives every single time.
Mhm.
And burnout, I don't know if you've ever looked at the actual definition of burnout by the World
I
Health
have not.
Organization. So it's actually defined as workplace stress, or as stress, unmanaged stress caused by the workplace. So it's actually a condition. They call it a syndrome, actually, which is interesting, but it's caused by workplace stress. And it's associated with diabetes, heart disease, even early death. And so it's this workplace stress or the stress that's caused in the workplace creates this emotional state. It changes our physical health. And
Mhm.
that's what makes employers so powerful, because they actually have the ability, based on just this consistent access to employees, to change the way that people feel every single day.
That's fascinating. I think a couple things jump out at me. One, the definition of burnout as unmanaged stress. I think right there in the definition, it's acknowledging it can be managed. Working is stressful. I don't care who
Yep.
you are. Very few people are fortunate enough to have a job that they don't find stressful at all. And it's about managing stress. And to your point
Yes.
from earlier, employers have the best opportunity or angle to do that. They have the access, they have the reach, they have the awareness, they have the incentives. And the other thought I had was I was thinking about, you started that response with a question, comparing the 2 days, you have a horrible day or you have a good day. How do you carry that through?
Hmm.
And, I can only speak for myself, but I am a version of myself that I don't necessarily love when I've had a really bad day. Hurt people hurt people. And
Yeah.
sometimes if you're hurt during the day, you go home and you're hurting yourself, like you said, whether that's drinking or unhealthy food or binging Netflix, whatever the case may be, all things that, in moderation, fine. But when you spend your day being a punching bag or feeling like you're getting it from every direction, it's a lot harder to go home and treat yourself or the people that you love with grace. And so
Yes.
I completely see that. I think about that idea in the confines of like my kids are all in school.
Mm.
And if my kids came home every day and described their school day the way that I would describe some of my work days, I would pull them out of school. I would say,
Uh-huh.
you can't be there. That's not healthy. Now, I think someone listening might say, well, yeah, Matt, you're paid though. I would counter by saying, yeah, I'm not paid to be abused. That's a component of having a job that's not present in the education
Yes.
system. But there's a lot of, it's easy to kind of paint all of that with a broad brush. But I think if you step back and you think about the two, there's a lot more similarities. And if someone you
Mhm.
loved was in a bad situation and you felt like, hey, this is impacting your overall well-being, you would want to do something about it as an
Mhm.
outsider. So as a company, again, with the benefits economically that you just laid out, it really seems like a no-brainer.
Yeah. Yeah, it seems like a no-brainer.
Let's talk about Exhibit C. Like I said, I haven't had a chance to read your book yet, but I did read
Yeah.
about your book. And I saw something that I think is a line from the book about how true well-being isn't a vacation. It's built from the inside out.
Hmm.
So as I mentioned, I work for
Yes.
a company, it's a growing company, and it moves quickly. It's stressful. I have team members. I told you before we hopped on here, one of the most important things for me as a manager is making sure that the people that I rely upon feel supported. They feel safe. They feel like they're in a position to be successful. Something you just said before I forget it that I'm going to borrow or steal is asking them about how the work that they do for me and for the company affects them in their personal life. Because I consider myself relatively empathetic and forward thinking. I had never considered approaching it from that direction. So that right there is the cost of admission. But let's talk about those concepts. Let's talk about how well-being isn't a vacation. I think you call it capability. And so
Yeah.
walk us through that concept.
Yeah, this was a harsh personal lesson, actually. So I was working at a job that I loved. I think I mentioned this earlier. It was a stressful job, but I loved it. The work was important. I loved the teams that I work with. It was really my dream job and my dream employer. But I was exhausted. I was working maybe 60 plus hour weeks. I was on a plane almost every single week. I had a boss that I thought was less than awesome, we will say. And I was finding myself just really, really low on patience, energy, high on anxiety. And I was really struggling. Mix that with I'm positive for the BRCA gene, the gene that causes breast cancer and ovarian cancer. And so in addition to we all kind of make that statement sometimes like, oh, this job is killing me, and we mean it kind of figuratively, but
Mhm.
with this BRCA gene, I had this real belief that this job is also killing me very literally. Uh and I was very concerned about that. And so I probably swung the pendulum a little bit too far the other way. I quit my job. I had no plan. I packed up my house. I moved to this little island in the Caribbean called Roatan, Honduras. And I just was thinking, this is the answer. Like, this is how I need to find my health, because I need to find my health. And it worked great for a while. Like, for a few months, it was, scuba diving every day and sunsets every night and a little bit too much rum, probably most days. And then I got bored after a couple months. And so I got this job at this little place called Frank's Cigar Bar. And I made $11 a day for an 8-hour shift. So it was not about money. I just needed something to do.
Sure.
And about probably 6 weeks in, I started having those same feelings. I was like annoyed with customers, frustrated with my boss, impatient, like even in this paradise island. And it really hit home that line that we've always heard, wherever you go, there you are. I
Mhm.
was like, oh, here I am. I know you. I remember
Yes.
those feelings. And it was very depressing to realize this thought, because I'd kind of been hanging my hat on, is the organization's fault.
Yeah,
It's
it's not me, it's them. Yeah.
yes. Yeah.
And then
And
you're
they
like, no, wait, it's me.
Yeah, so that was so embarrassing to realize. I was like, "Oh gosh." And so, but it was also very freeing, because then I can do something about it without just
Mhm.
quitting my job and move to an island. Not everybody can do that, nor do they want to. They shouldn't have to, right? Um, And so I really dug into research mode. I am not a trust fund baby. I knew I had to go back to work at some point, and so I thought, how can I do this in a healthy way? And so I started researching, just trying to figure out, I think I was even Googling things like, how do I have a stressful job without letting it kill me? And this is where I started to put together. And then I took that neuroscience class because I've always been a leadership coach. It was a neuroscience class for coaches. And I started to put together in my head, oh my gosh, well-being is really just a set of skills that we can learn. You've probably seen this in your life where people think a new job is the answer. They get the new job, they change organizations, they take a vacation, and they feel good for a little bit, but then those stress patterns start to come back after a while. It's because it's inside. It's something we need to learn how to deal with, and so how we regulate stress, how we focus our attention, how we manage our energy. All of those things are skills that we can learn, and it's something that we have to figure out on the inside of us.
Wow, that is quite a story. I'm thinking about myself and that, not in your situation, but there's so much of us, and I'm guilty of this. You attribute it to the company, right? I'm fine.
Hmm.
I'm healthy. I'm balanced. I'm reasonable. This is happening to me. And it sounds like that's where your head was when you left your dream job. And then
Yeah.
you kind of had to stop and take ownership for a moment of, you know what? I'm probably playing a bigger role in this than I really want to be honest with myself about.
Yes.
And so
Yeah.
that's it, right? A vacation or a new job, that's pattern interruption. You might be pausing something, but you're not solving it. And so that's not to say that
Hmm.
companies or employers are without any sort of culpability. Obviously, there's always things that companies can
Yes.
do better. Even some of the best companies I've ever worked for struggled with things. But I think as employees and human beings, we have to acknowledge that, we do play a role in this. And it might vary on how large of a role depending on the company, but
Yes.
it's not a it's not a one-sided issue.
Yes. Yeah. I did not like learning that lesson. If
I mean,
I
at
be
least you got to
very
be on an island drinking rum when you learned it.
Yes,
That's,
it's true. It's
better than
true.
probably where most people found that.
Yes, that's
So,
probably true.
so Kara, let's talk about Exhibit D. This is our final exhibit. Your book, from what I've read, it provides a framework, 5 inquiries. It's right there in the subtitle.
Yep.
I love, as a lawyer and as a very, very type A person, I love a repeatable operating system or a routine. So those sorts of things to me are like a holy grail. And I'm sure in your book you go into great detail. I would love to spend the next 3 hours hearing all about it. Obviously, our listeners have other things to tend to. So that would be where I would plug that people go out and pick up your book and read about them. But for today, given the limited time that we have, tell us about those 5 inquiries and
Yeah.
what do they unlock for a company that's reflecting on the things that you're talking about and thinking about making changes.
Yeah. It's yes, we can't cover it all in this talk. It's a lot of information. But it really the 5 inquiries is I'm a very practical person. And so I would read a lot of kind of self-help books or other things, and I'm like, this is great, but tell me what to do about it. What do I
Yeah.
actually do? And because that's how change happens to me. So I kind of put all of these things that I learned and put it in this framework that's very practical and just makes sense. It makes it operational. And so the 5 inquiries are basically exactly what it says, 5 questions that you ask yourself that really teaches those true well-being skills, that then those kind of inner skills that lead to a different way that we present ourselves outwardly. And so it starts those 5 inquiries just very briefly. It starts with these each phase kind of has a question. It has the inquiry that goes with it. It has a couple themes that you learn to help you learn. I really took a learning model approach to this. How do human beings learn new skills? And so it has these themes that we learn, a couple of new skills that you learn. And then it takes you to that kind of core, true understanding of yourself and this ability to manage your emotions, regulate, manage your energy. So the first question is just, what do I believe? We'll go through this just for an example.
Mhm.
And so you have to ask yourself that question and be able to answer it. And it goes into thoughts, emotions, and beliefs. So what are these beliefs I'm walking around with? What emotions are helpful to me and what emotions are maybe not so helpful? And then what skills can I learn? In that first phase, they are self-awareness as a leadership skill and breath. So I really approach things two ways: psychologically, so that self-awareness, but also physiologically. How do we work with our brain and our nervous system in a way that we can help show up in the way that we want to? So the second question, then the second and third questions really are still kind of self-focused. So like, where have I been? Like looking back at where did these beliefs form? How did those start to where did those patterns show up? And then really the third phase in really looking at why am I here? That kind of age-old question of values and or purpose, what meaning. And then phases 4 and 5 go into kind of move into others. So phase 4 is really around who do I influence? So thinking about your inner circle, who's in your inner circle, the skills or leadership skills people don't really think about. Compassion, forgiveness is a leadership skill. And then moving into that last inquiry, how do I show up? And really thinking about our habits and routines and what things can we do to show up in the way that we want to show up. So it's just a really practical framework to help people figure out how we function well under pressure, because there is always going to be stress and pressure. There's just no way around it as a human being. So,
Yeah, those questions sound very direct, which, as a lawyer, I love, and very easy. I think you'd be hard pressed to find someone who couldn't ask themselves those questions and have some degree of an answer.
right.
They're not layered in academia or theory or concept. They're just very straightforward. How do you show up? I could spend the next 5 minutes telling you how I show up as a manager. And I think sometimes it's just about being honest with yourself and reflecting on that rather than,
Yes.
I guess I'm doing a decent job. So it sounds very straightforward. And I'm definitely looking forward to
Yeah.
posing those questions to myself when the book arrives.
And those questions, I have found a lot of people can answer them somewhat, but when they dig in a little bit, it helps them realize things they maybe haven't thought of. And I actually tried this out. One of the things I talk about in phase 1 is the inner critic. And so most people don't talk about this at work, but I introduced it in this, an organization had hired me to do some leadership training. And so I kind of slipped it in as well to this very kind of blue collar, male dominated industry. And one of the guys, as we're going through it, he just kind of whispered under his voice a little bit. He said, "Oh, I thought it was just me." And everyone kind of laughed uncomfortably. But then we had this whole conversation of our inner critic and what that voice sounds like and how that shows up in the workplace and how that shows up in interactions with his boss or with his employees. And it was really game changing for that whole group to walk through that.
You have to point me to the page that's on in the book, because I have a very loud and unrelenting inner
Oh,
critic.
gosh.
And he
Yeah.
follows me around all day. Critical feedback is part of it is how do you receive it? And then the second part, to me at least, is what do you do with it? So there's absolutely value in that inner critic, but
Yes.
I think we all have it. And to your point, it's not the part that we talk about out loud, and it's not a comfortable
Mhm.
conversation because there's vulnerability there. So being able to put language around these ideas and just tossing it into the middle of a room like you did, it forces a conversation. And I would imagine
Yeah.
at the end of that conversation, although it may have been uncomfortable for most of the people there, it probably helped a lot of people get
Mhm.
comfortable and acknowledge, you know what, to your point, his words were perfect. So it's not just me.
Yes. And I tell leaders, a lot of these topics they don't want to talk about in the workplace. And I get it. I spent a lot of my HR career saying, do not go there. Like,
Yeah.
don't ask those questions.
Lawyers do
As
that
a
too.
lawyer,
Let's
I
not
bet
talk
you did
about that.
too.
Yeah.
Yes, exactly. And so my book is very specific to say, how do we introduce these into the
Mm.
workplace that's reasonable? Because leaders are not meant to be therapists. That is not their job. And that is not what I'm advocating for. But there is a way that we can talk about these things that are there anyway. Somebody's inner critic is showing up, whether you talk about it or not. And so how do we help employees with that?
Yeah. I think we're past the time where maybe in the 1950s, this would have been okay to say, but it's like, we don't talk about that here. I
It-
think we live in a day and an age where people, to your point, it has to be with the right side of language and it has to be introduced the right way. But I
yes.
think about some of the things my kids learn about in school, and as a parent, I'm excited and happy because it's progressive and they're learning about things that I didn't learn about until high
Hmm.
school or beyond. But it's all about being intentional about it. And it's about having the conversation in the right way for the circumstance. And
Yes.
so I think saying those things out loud is so good. I have a quick, we'll call it a sidebar.
Yeah.
So the company I work for currently is fully remote. And I, as a member of the executive team, we were on a call last week as an executive team, and we were talking about ways to raise awareness of other employees and who they are outside of work. Because in this day and age, a fully remote company, you lose a lot of the humanity of like knowing who you're talking to. You get on a call, you see someone, you barrel through something for 15 minutes and you hang up. And if there's any sort of friction, the first thing you do is and I am guilty of this, you assign like negative intent, or someone doesn't care, or they're not getting it. And I have found that in my experience, I'm of a certain age to where I did do the full-time job in an office, water coolers, lunches with friends. And when things got hard, you will humanize those people. You're like, oh, he's a dad, or that's a mom,
Yes.
and I don't do that now. And so last week we were having a meeting talking about how to fix these things. And I had as I've gotten older, I've been much more comfortable kind of just saying what I'm feeling. And I said, for me, the biggest challenge at this company, which I love the company and I love what we're doing, but the biggest challenge has been the lack of humanity and the lack of connection.
Mhm.
And not exaggerating, but two other executives wrote me on Slack as I was saying these things and said, thank you for saying that out loud. I thought I was the only person that was experiencing that.
Wow.
And I immediately felt closer to those two people because I thought, oh, they felt safe to bring that to me. And so, did it fix everything overnight? Of course not, but it's a step in the right direction. And so I think being willing to have conversations that were previously taboo or this isn't the place for that, it's a significant step in the right direction.
Yeah. I thank you for sharing that. That's
Mhm.
that humanity. And then I think you said the word intentionality around it is super important. And just as a quick sidebar to your
Mhm.
sidebar,
Sure.
there's when you were talking about, this tendency um, to be on a call with somebody and to say, oh, they just don't get it, or it's to kind of make this decision about somebody is that's how your brain working really quickly.
Hmm.
And I talk about this a lot in the book is it's called the fundamental attribution error, which people don't have to remember that, but just to know that your brain is going to do that pretty naturally, and just the intentionality and the awareness around it that you seem to exhibit there is really, really important. It's it's a good function to use. So the brain it has helped us. But we need to be aware of what's happening in our brains so we can decide, do we want to keep that attribution or do I want to challenge that a little bit?
That's the first thing the first step for me in that process, and it's an ongoing process, was just reflecting on, okay, why am I showing up differently here and
Yes.
feeling differently than I did at my job a year ago, right? These are all smart people who care. We're not doing anything meaningfully different from a company perspective. What's the variable here? And I had to stop and say, oh, you know what? I'm
Mhm.
lacking these relationships and these connections, and it evolved from there. And I have the CEO of my current company. He's a great guy. We ended up having a long conversation on it one day, and he was
Uh-huh.
just like, it's something that I feel companies who are fully remote or primarily remote will continue to struggle with. And so
Yeah.
again, it's hard to put a dollar value,
Hmm.
positive or negative on that. And so a lot of it just becomes academic and intellectual, but I think the first step is having the conversation. So it's nice to be alive at a time where those conversations are happening.
Yeah, I agree. Totally agree.
So, Kara, next we're going to move to our objections. This portion of the episode is pretty quick, but I wanted to throw a couple hand grenades at you and just get your perspective because you've built a very confident and complete case so far. But I think one objection that somebody who's listening might have is, so you're telling us that we should make employers responsible for something that belongs to the healthcare system, to public policy, or to personal responsibility. Companies, they give us insurance. What more should they be doing? So I guess the question is, are we just turning managers into amateur doctors and therapists? And if we are, that doesn't seem to fit the job description I'm sure most people sign up for.
Yeah, that is the biggest pushback I get. Um, and it's a very common one. And it's a question I ask myself. And the short answer is no. Um, I'm not asking employers to replace healthcare, public policy, personal responsibility. All those employers should not be doctors or therapists.
Right.
Um, at the same time, I will say, actually, yes, the burden should be on employers. And I know this is very controversial, but I do believe employers have responsibility here. And if you think about the physical safety of employees, employers are responsible for that through OSHA, and nobody argues that. Nobody believes that employers should not be responsible for the physical safety of their employees while they're working. And if you look at mental health, if you look at the definition of burnout, it's unmanaged stress. And the World Health Organization is very clear to say that that is work related. It actually goes as far as to say this should not be attributed to other areas of stress in your life. It is a work related issue that is created by work. And the interesting thing to me is employers should want this responsibility because burnout impacts about 77% of people. It costs them millions of dollars every single year. And so it's almost like they're creating their own dragon to slay. Like they're creating the burnout and then they're paying the costs of burnout through all of these things that we talked about.
Yeah.
So in that vein, I would say, yes, employers have some responsibility and they should want the responsibility because they can do something about it and they can really impact their employees in a different way. And healthcare still plays a very critical role. Public policy plays a very critical role, and so does personal responsibility. So just like any other skill you learn at work, your employer's responsibility is to teach you the skill or to get you the training, but it's your responsibility to use it, to learn it, to know it, to apply it where it's supposed to be applied. So that personal responsibility is still there. So it's a yes and a no answer, I would say there.
Yeah. No, but it definitely makes sense. I can see, to your point, the companies aren't there to replace these other institutions, but it can
No.
be a collective effort, and companies are uniquely situated to reach employees and to set them up to be successful in ways that healthcare or pharmaceutical companies, those are reactive, right? For the most part,
Yes.
those are reactive industries, whereas a company has the ability to be proactive. And, unfortunately, as we've talked about a few times, I think the more we talk about this, the more it becomes just painfully clear that the hurdle here is it's a faith-based exercise up front because you're not going to see a return on it for a long time. But if you had the benefit of looking back 20 years and seeing how many people stayed in their role and learned and evolved and how much institutional knowledge you built and how much better people were able to do day to day because they showed up in a healthy way, I imagine if you had one or two examples of that, a lot of companies would fall in line.
Yeah. And you're right, it is the long game. But part of me is also looking at if we could get more employers as a whole on
Mhm.
board, then when you recruit people into your organization, they're already coming with these skills that they have maybe learned somewhere else, just like
Mhm.
any other skill they learn in any other job they go to. So it is a long game, though. I do realize that.
Yeah, but it's a baton, like to your point. It's not,
Yes.
it's like
Yeah.
school. Again, I keep going back to my kids, but I keep thinking about, the educational aspect of this. I have a daughter in second grade, a daughter in sixth grade, and a son who's a sophomore. Every teacher that each of them has handed the baton to the next and said,
Yes.
hey, keep teaching them this. It'll benefit them in the long run. But to your point, if only the fourth grade teacher's doing it, then people are like, oh, that's
Right.
interesting. And then in fifth grade, they forget all about it. So,
Yes. That's a great analogy. That's perfect. Yes.
um,
Yeah.
so let's talk about the second objection. So a lot of companies in this day and age, they will say, we do wellness. We are committed to the well-being of our employees. And that's not to say that when they say it, they're intentionally lying or, behind the scenes, they're plotting to, wreak havoc on someone's health. But, a subscription to a yoga app or a free healthy lunch followed by an 80-hour work week, like that feels very, I don't know what the word is I'm looking for, but it feels a little bit like ironic. And I guess, you know, it borders on somehow leaders telling employees, this is how you need to live your private life. So when you come back here tomorrow or Monday morning, you're the best vessel to do good work on behalf of the company. And I know that's probably an overgeneralization, but I guess the heart of the objection is how do you keep these ideas from just becoming another like hollow corporate slogan? You hear a lot about DEI and the backlash from that. And that's not to equate one versus the
Yeah.
other, but sometimes I think we have these groundswells in corporate America to say, oh, this is what's important now. And if you're a company and you're a large employer, you have to prioritize this. And then companies will say, we're in, but then nothing happens underneath the surface to actually follow through on that, and it becomes just a slogan that a couple years later is no longer in vogue. So what are your thoughts on how we prevent that from happening?
Yeah, it's a great question and a big challenge. And most organizations approach well-being kind of this two-prong approach through benefits and policies, and they're both super important. They're just missing a piece of the puzzle, and that piece of the puzzle is thinking about well-being as a capability within the organization through leadership skills and through the skills of the employees. And the thing that makes it last, that and this does get a little bit tricky, is just in any organization. I worked at Apple for a while, and they, at the time, I don't know if they still do, but at the time they had a culture of feedback. And it was an expectation that people give feedback and receive feedback. And in order to do that, they taught you classes on how to give feedback and how to receive feedback.
Hmm.
And if you weren't giving feedback, then you would get feedback on how you're not giving feedback. And it's an expectation in the organization. So if leaders can look at the math and say, hey, I know that healthy employees contribute to the bottom line, I'm going to set the expectation that people that learn these well-being skills, and they exhibit them at work with regards to how they show up with each other, how they show up at work, coaching people on those types of things. That is where we really turn well-being into a core capability that impacts the organization. Really, leaders have to think about, what is the culture that I want? And if this matters to them, then they have to put the time and resources behind teaching this well-being skill set. But it is just one piece of the puzzle. It's not the complete answer. The benefits and the policies absolutely matter. But this creating it as a core capability makes it less of a box to check and more of just good leadership for the organization.
Well, I feel like benefits and policies are, policies are table stakes.
Yeah.
In a lot of jurisdictions, benefits are table stakes. But even if you put in front of an employee, I mentioned, a yoga app subscription, that's a tool. But it sounds like what you're advocating for, again, as a large piece of the puzzle that's missing, is teaching employees how to use those tools. And that doesn't mean the app itself, obviously, but just
Right.
how to think about wellness as something that you're doing affirmatively, rather than trying to hope that employees are in a position to avoid unhealthiness.
Right. Exactly. Yes. Yeah. And it is recognizing that it's a skill that people can learn, is the piece that a lot of employers and leaders miss.
Yeah, the Apple system, unsurprising given that it's Apple,
Yeah.
but the feedback system sounds incredible, because I think that's a big problem. I've seen this in my entire career, government, law firms, corporate America, where, people will give positive feedback because they want to avoid an uncomfortable conversation, and there may be a lot of positive things to emphasize, but they'll kind of stop there, and
Yes.
it's almost like the thought of like, well, they're doing most of these things well. I'd rather not rock the boat and potentially drive a wedge between my employee and myself. But really, you're doing a disservice. You're preventing them from getting the benefit of understanding where they're falling short. And guess what? We're all falling short. So it shouldn't be a shock. And I would imagine that's part of the receiving feedback training, but just giving
Yeah.
people the ability to understand communication and those. I think about all the different trainings I do, IT security, phishing, cybersecurity, discrimination, harassment, all the things that are mandated and that I have to make sure our whole workforce is doing depending on their jurisdiction. And yeah, adding a 45-minute or 60-minute wellness or communication or feedback module doesn't seem like a stretch. And again, it's not the whole answer, but it would seem like a step in the right direction.
Right. Yeah. And I mean, similar to well-being, that feedback training, it was tough at first. It was hard at first when I first went there, because you got feedback in front of groups of people that was constructive feedback, but it
Mhm.
made me a much better human and a much better employee at my job, and lessons I still carry with me today. So
Yeah, feedback it's the best thing that you can get from a manager or a company, but it's the hardest thing to take. And
yep.
if you were to ask me, hey, Matt, are you perfect? I would immediately respond, like, authentically, absolutely not. I am the furthest thing from perfect. But sometimes I receive feedback like someone who thinks they're perfect. And I find myself thinking like, okay, what was that reaction? And it's because it's personal. And to your
Hmm.
point, and I'm sure this is part of the Apple training, It's separating the message from the emotion. Not that you can't feel the emotion, but taking the message for what it is, I would imagine, is probably the most important part, because if you shut down the minute you hear something critical, then everybody loses.
You're right. You're exactly right. Yep.
So, Kara, we have made it through our objections, and at this point, we are nearing the end of your case. The last thing I would ask you to do is to make an impassioned closing argument for anybody listening that wants to plant the seeds of these ideas at their current company. And I would suggest to those people who are listening, while I'm sure Kara is going to nail the closing argument, pick up the book and read about these concepts. And with that, Kara, I'll hand over the floor and take it away.
Yeah, thank you. My closing argument is really just pretty simple, actually. It's people should not have to choose between their health and their career. They shouldn't. And at some point, employee well-being just becomes a leadership decision. And as a leader, you are responsible for the financial implications of your team, for their productivity. And if that matters to you, then employee well-being has to matter to you as well, because they go hand in hand. And then on my own personal front, I would say, and if you do happen to care about your employees and their kids and their families, that's impacting their personal lives is just icing on the cake as well.
Yeah. Great. Yeah, I think the economics are that right there. I think the case should be won. But to your point, and I work with a lot of great people, and I know that they care about our employees and their families. And so, you would ask them, oh, I've seen so many situations in my career where it's like, oh, so-and-so's, brother passed away, or their child is sick, or whatever. Like, what can we do to help? And when there's that moment, people have no problem rallying. And it sounds like if we could just take that energy and make it persistent and repeatable every day, that would yield some really incredible outcomes. So,
yep, I love that frame. Yes.
So, Kara, we've rested your case. And one last thing I like to do before we wrap up each episode where a guest joins is to move out of the courtroom and into the real world. And I think you've already given us a lot of ideas and examples. But for those same leaders who just listened to your closing argument, who sees the merit in what you're saying and wants to take steps, but is also managing the needs and demands of their job, do you have any micro tools that you can give to them to start using today, tomorrow, the next day, that might inch them closer to helping make this case?
Yeah, I would start by saying, look to yourself first. And all the sayings, put on your own oxygen mask. You can't pour from an empty cup. All those things are true with well-being. So look to yourself first. How do I respond under pressure? How do I respond to stress? How do I show up to my team? And most of us know the things we can be doing to be just even a little bit healthier or a little bit more well, whether that's going to bed 30 minutes earlier, doing a quick little breathing meditation on our way to work, calming or like slowing down a little bit before we react to something. So just pick one small thing and try it for 2 weeks and just see how you do. Treat yourself like this is a little learning lab, because not everything works for everybody. So pick something small for yourself and just try it. And then the second piece I would say is actually what you said you wanted to do, is start asking that question to your employees. Ask them, how is work impacting your health? What could we do? How could I lead in a way that would make things feel a little bit better for you? And this isn't about solving everything. There's some things you're going to have to say no to. Sometimes work is just stressful and full of pressure, but understanding that, knowing where your employees are at, is going to go a long way to helping them even just feel heard, even in the stressful times, which that in itself brings their stress level down. I would say start with those two.
I think anyone listening would be hard pressed to say, I don't have time for those things. They seem to slot in pretty easily to, I think, probably the regular working professional's day. So I appreciate those, Kara. So, Kara, listen, this was incredibly compelling and unfortunately uncomfortably true in my experience. For those of you who are listening, as I've mentioned a couple times, Kara is the author of Health Wanted, Inquire Within. If what we talked about here today and the points that Kara made were interesting to you or hit home, go find that book and start building an infrastructure in your own organization. Kara, for anybody that wants to read more about you or perhaps reach out to work with you, where can people find you?
Yeah, mostly LinkedIn and Instagram, Facebook, and it's just my first and last name. Easy to find me.
Great. And Kara, I will, as we talked about, I will get those account names and I will put them in the posts and in the messages in the comments for this episode so people can reach out directly. Kara, with that, I just
Thank
want
you.
to say thank you for spending this time with us. It's been a true pleasure.
Yeah, thank you. It's been awesome.
Of course. And to those of you who are out there listening or watching, thanks for joining me and Kara as we explored this very important topic. This has been The Case For with me, Matt Campobasso. Remember, whatever your case is, don't be afraid to build it and carry it out into the real world.